Thank you for the opportunity, firstly, to get to present my study as briefly as possible. The study is entitled Investigating Factors Influencing Adolescent Sexual Health, and this was done in Umlazi in Durban, KwaZulu-Natal. And basically, sexual debut is a crucial topic when we're talking about adolescent sexual health. There's a lot of debate in literature, particularly about sexual debut being a normal developmental milestone versus the risk associated with problem behaviors. And mainly this highlights important implications for sex education policies and interventions that are out there. And it also emphasizes the need for evidence-based research. So the onset of adolescent sexual debut is shaped by diverse contextual factors, and understanding these complexities is vital for developing tailored support that is necessary for adolescents. And we've seen that through discussions with adolescents that it's important to have tailored support. The objective of the study was to investigate sexual debut onset and to also characterize factors associated with sexual debut among adolescents that are between the ages of 10 to 19. As I said, the study was in Umlazi, but we focused specifically on Usinga HDSS, and yesterday we got introduced to the director of Usinga, which is a new urban HDSS in Durban, or in KwaZulu-Natal in our province. So it's estimated that the site has over 15,000 adolescents between the ages of 10 and 19, and of those, 1,211 were randomly selected for the study. And data collection was done using the ARISE Adolescent Health Survey, and analysis was performed using SATA. And I'm going to quickly talk about the results, but I'm just going to give a brief overview of the sexual debut distribution findings. And in that box there with the results, we can see that early sexual debut due to sex before ages of 15 does occur, but the most common is at age 16 with 34%. I don't know if it's possible to see. So with 34.2% of adolescents initiating sexual activity round about the ages of 16. And from this, females exhibiting a higher prevalence of sexual debut. And then a correlation matrix was employed just to ascertain the significant determinants influencing the timing. The correlation matrix was used just to ascertain the significant determinants influencing the timing and context of adolescent sexual debut within this cohort. And I'm just going to quickly name some of the factors that were identified as having significance to sexual debut: and age at first sexual intercourse, the gender of the respondent, the onset of alcohol consumption, age of initiation, age of smoking, but not just smoking, substance abuse, and economic status. And basically these determinants have various implications on adolescent health. And we're looking at things like susceptibility to STIs, unintended pregnancies, substance abuse as well being a problem because it can diminish awareness of safe sex practices, heightening the likelihood of unprotected intercourse. And also, inadequate knowledge may render adolescents more susceptible to coercion and manipulation in sexual relationships. So these factors basically underscore a complex interplay of various influences on adolescent sexual health. And addressing these findings requires comprehensive age-appropriate strategies, because we see that in the different ages, the strategies have to be very specific. And I mean, there are different programs that one can look at, particularly collaboration with the adolescents and fostering open communication about sex and relationships, which can empower adolescents to make more informed choices and navigate their sexual debut safely and responsibly. Thank you.